My involvement in the SHINE project has been as one of the 3 pharmacists to undertake medication reviews for the residents in the care homes. Now, as part of this, we've had to utilise primary care notes and also the care home records. We've then worked as an MDT with the carers in the home and also the GPs to discuss the proposed interventions that we've come up with. We also discussed the interventions with the carers at the care home and also any relatives where it was appropriate to aid our decisions in the medication changes, if appropriate. It's important for a resident to have their medication reviewed just to ensure that the medication they're taking at that time is clinically relevant. The medication review involves utilising all available resources, whether that be notes or healthcare professionals, to gain a good background of why a resident's been prescribed a particular medication. It allows you to make decisions about a particular medication, whether that be continuing it at a certain time, discontinuing it, or changing any particular doses. When asking the question, does the medication have a purpose, we should be thinking about, have there been any changes physically to that resident's condition? So it may have improved, in which case they don't need certain medication, it may have deteriorated. So we need to be asking, is that medication clinically appropriate for that current time, for that resident? Secondly, we should be checking, is the medication for an acute purpose or long term? Often medication's left on long term when it should just be acute, so we need to be looking at that. We need to also be reviewing the risk versus benefit, because what was a massive risk maybe 20 years ago may not be now, so we need to be looking at that. And also questioning the end of life decisions and ethical considerations. When looking at whether a medication is appropriate and safe, you need to consider the dose of that medication. So again, as the patient gets older, various changes, whether it be pharmacodynamic or pharmacokinetic, happen to the body, and this affects the way that the body is able to handle the medication. If the dose was commenced, say for example digoxin at 125 micrograms in someone that was 60, it may be that when they're a bit older, it may need to be reduced to 62.5 micrograms just to allow the body to handle it slightly better. The second thing we need to consider is the formulation of a medication. So a resident may have issues with swallowing tablets, but it doesn't mean they can't take that medication. We just need to look at other ways to take it. There may be a liquid preparation. In terms of formulation as well, though, we need to consider liquids, because if a resident is taking lots of liquid medication, we need to consider the volume. That might actually be detrimental, and a resident might not want to take that much. The final thing that needs to be considered with regards to this question is whether there's any interactions. So whether it be medicine to medicine interactions, whether it be a medication interacting with food a resident's eating or any drinks they're drinking, because that all affects how the medication is going to be handled by the body. When considering if there's any medications that a patient would benefit from being added, we need to consider whether a patient has actually had that medication before that you're considering, because it may be that it's been commenced and then discontinued because they've not tolerated it, or there may be an issue, or it may be that it's been discussed in notes and stuff but never actually commenced, and we need to look at reasons why. Now this might be because the resident has actually stated they do not want to have it. It's important to have the patient involved in the medication review, because at the end of the day it's their medication that you're discussing. And also it might be that you're proposing stopping a medication, and that's going to make them more anxious if they don't want to stop it, or if they don't know that something has been stopped or the reasons behind it. Or it might be that you're contemplating starting a medication but they actually don't want the medication. So I think because it's their medication that you're having an involvement with, they should be involved.